80% cholesterol structure is coming from the carbohydrate. Cholesterol is not converting from the fat to cholesterol. 80% is coming from carbohydrate. So if you check your sugar and carb, get rid of inflammatory fat, what we do, all the greasy food and steroid-based meat and burn meat, NIH declared that burn meat is inflammatory carcinogens. They clearly declared that. So you get rid of the wrong fat and then you lower the inflammation. So liver will not make any more unnecessary cholesterol. Your cholesterol is going to be good. Instead, if you get healthy fat, liver will make a good cholesterol HDL. Liver will make a good vitamins, because all the fat soluble vitamin D, K, A, E, those fat soluble vitamins coming from the healthy fat.
Hello, I'm Dr. McJunkins, Austin McJunkins. Got my degree at University of South Carolina. Did some surgery training. Did 5 years in the Air Force, and now I work at a family practice in North Carolina. We'll be talking to Dr. Haque.
I'm basically came from scientist background. I was a scientist in University of Texas Medical Branch. After finishing my PhD, I decided to start further research on my medicine because my PhD was on bioorganic chemistry, mostly cancer drug. So after finishing my school from University of Wisconsin, I moved to Texas. While I was doing my research on medicine, I realized that our medicine is not enough to fix someone's health problem completely unless you go integrative approach. Then I started focusing on all other healing support that someone need. I went to Harvard for my nutrition program. They have an amazing program. It's called Nutrition, Health, and Science. So I finished that, and then I went to integrative school for integrative medicine certification, functional medicine university for functional medicine certification. So I've been practicing now with a naturopathic background, functional medicine approach, and you can say like integrative approach. I'm helping patients to focus on underlying health issues.
No one's actually checked their cholesterol,
Mm-hmm.
and I check it, and of course it's high. I treat it, and their blood pressure becomes so much easier to control. So I think a lot of people, of course, they want to know, what can I, as a patient, what can I do about my cholesterol in order to improve my overall cardiovascular health?
According to medical guideline, whenever you have a high cholesterol, LDL or overall cholesterol, you have to continue your medicine forever. You have to be statin drug forever. But some doctors I saw, some cardiologists I saw on my patients, they said, okay, your cholesterol is normal. You don't need to take any drug anymore, statin drug. And I have maybe hundreds of patients so far. They got cholesterol level very normal. They got rid of medicine. So I say, okay, I take their interview. What did they do? So that other people can get benefited with their lifestyle they changed. So what I do, I say, you eat fat, but healthy fat, not the wrong fat. You get high cholesterol because of you got wrong fat, make a lot of inflammation in the body. And liver makes cholesterol because you have a inflammation in the system. Because liver job is whenever anywhere have a inflammation going on, either in the heart, artery, or anywhere, liver has to make cholesterol. And we have a misunderstanding that of fat converting into cholesterol. Actually, dietary fat only have 20% contribution on converting cholesterol, because cholesterol liver produces as needed whenever have inflammation. And not even fat. 80% cholesterol structure is coming from the carbohydrate. Cholesterol is not converting from the fat to cholesterol. 80% is coming from carbohydrate. So if you check your sugar and carb, get rid of inflammatory fat, what we do, all the greasy food and steroid-based meat and burn meat, NIH declared that burn meat is inflammatory carcinogens. They clearly declared that. I don't know why people still. I'm in Texas. Texans love barbecue. Every house have their machine in the back. I had one, but now I don't have one. I'm sure I don't have one. So anyhow, so you get rid of the wrong fat, and then you'll lower the inflammation. So liver will not make any more unnecessary cholesterol. Your cholesterol gonna be good. If you instead, if you get healthy fat, liver will make a good cholesterol HDL. Liver will make a good vitamins, because all the fat soluble vitamin D, K, A, E, those fat soluble vitamins coming from the healthy fat. Their cholesterol is their fat is their precursor. So you get a healthy fat, you get a healthy vitamin profile, and at the same time avoiding the wrong fat, so you won't have a cholesterol in the body. So that's the dietary part. But also they need to lower their stress, lower the emotional trauma. They need to make sure that they don't have a insulin resistance, they're not diabetic, they need to improve their digestion. So in the pill format, what we do, doctor, we focus on mostly CoQ10, magnesium, and then vitamin DK if they're deficient. Of course, omega as well, because the root is the inflammation. And then body doesn't make any more cholesterol. It's normal. It takes sometimes few months even, because it's a long run inflammation. It's a long year long inflammatory response caused cholesterol high. So it takes time to get into the normal range.
What I tell my patients is, they're like, well, how can cholesterol affect it so much? I was like, well, think of a garden hose that you use outside. Put your thumb on it. What happens, right? It comes out. The pressure is higher. Well, that's where the high blood pressure comes in. Now your heart's straining because it has to pump even harder to push that blood throughout the body. And when I kind of explain it like that, they're like, oh, they don't think about these things. And I think the other thing I like that you said was kind of alluded to, well, if you don't change your underlying habits, none of the medicine matters.
Nothing gonna work.
Because you look at the studies and all the research, well, we used to have medicines that raised your good cholesterol alone. With you doing that, did not change the bad outcomes for patients.
Yeah, you still kept your hose on, If you don't stop the hose, it's just cleaning only mopping the floor is not gonna work unless you stop the hose.
Exactly.